So talking about Gracie University, we got Gracie Medical Defense. Don't hit me with that copyright strike, please. It says workplace safety solutions that actually work. So I was actually talking to my friend Jer. He's a physical therapist. He was saying a lot of these situations occur in the that at home health. The home health with the nurses. So I think it is worth learning. Especially if you're in this medical field. I want you guys to stay safe.
Kicking, strangling, grabbing, even biting. When it comes to workplace violence, healthcare is the most dangerous profession in America. A reported 73% of all workplace violence incidents occur in healthcare. And if you work in this space, you are 5 times as likely to be attacked on the job than any other profession. What's worse is that the training these selfless staff members are currently receiving is outdated and disastrously ineffective. As a result, not only are patients and staff members sustaining serious injuries, but a lot of really good people are leaving the profession altogether. Introducing Gracie Medical Defense, a workplace violence prevention program that actually works. GMD addresses all the most common threat scenarios in healthcare while prioritizing patient safety in every interaction. We utilize no strikes, no joint locks, and no chokeholds, yet we teach everything from verbal de-escalation and distance management to personal defense skills for worst case scenarios in standing, bedside, and even grounded encounters. GMD also includes the proprietary SafeWrap system for when a patient needs to be restrained with the lowest probability of injury to all involved. And it was carefully designed for use on pediatric patients, dementia patients, and everyone in between. We had a chance to pilot GMD at one of the largest hospital systems in California, and the results were astounding. Before GMD, a mere 26% of clinicians surveyed felt that their training adequately prepared staff members to deal with realistic threats from physically aggressive patients. Whereas after only 4 hours of training, 100% of surveyed clinicians felt that Gracie Medical Defense adequately prepared staff members for those very same threats.
I've worked at UCI Medical Center for 36 years. When it comes to workplace safety, Gracie Medical Defense ranks at the top.
With the violence and aggression that's rising, it's actually made me think about leaving the healthcare field. And just even having the 4 hours with Gracie Medical Defense, I just feel all that more confident that I do want to stay and that this is where I want to be.
I've done CPI and I've done Gracie SafeWrap Medical Defense, and it's not comparable. It's way more beneficial than anything I've learned at CPI.
For the first time in my career, I feel like the hospital is finally taking my safety and the entire staff's safety seriously.
It doesn't matter if you work clinical or security in a hospital, home health, care clinics, even fire EMS. Gracie Medical Defense is the future of workplace violence prevention. Join us at one of our upcoming 5-day GM.
Yeah, guys, you can say what you want about the Gracies, but they know how to market, and they know their I don't want to say clientele. They know who their demographic is. So think about adding some of these programs to your school, your academy. If you're close to a medical facility, think about adding this kind of course. I'm sure you'll get a ton of people in. So think about it. Some people don't want to roll, man. You just gotta accept it. They don't want to roll.
Certification course.